Hi, I'm Dr. Rohrich from Rohrich Knows. Welcome to Dallas, and let's talk about crazy trends in cosmetic surgery and plastic surgery. We see so much crazy stuff on TikTok. Sometimes you don't know what's normal and what's not normal. So to help us sort this out, I've asked somebody who's an amazing plastic surgeon and somebody who I trained a decade ago, but she doesn't look a day over 25, Dr. Smita from New Jersey. So Smita, welcome.
Hi, how are you? So glad to be here.
It's great to have you, and make sure you follow her both on TikTok and Instagram at Dr. Smita. She's got some incredible, great advice, and that's exactly what we need today. So what is going on? It seems like it's just kind of ebbs and flows, but recently it's been really ebbing a lot and flowing, just crazy stuff about everything. You know, last year I thought, the implants were getting smaller, the lips were getting smaller, and then all of a sudden I see the crazies again. So how do you sort this out, Smita, like when patients come to see you?
I know. I mean, it's incredible how much the pendulum swings when it comes to what we're seeing on TikTok or Instagram with plastic surgery results. And at the end of the day, I always tell my patients, and I truly also believe that plastic surgery shouldn't be trendy, right? You're doing these procedures or treatments because you want to feel more confident and feel better about yourself, but you shouldn't be getting over-exaggerated lips because half of your friends have over-exaggerated lips, right? So, everything that we do is just for you, and it's very personal. But yes, I think every single time there's a trend towards more natural, smaller, within a few months, it's right back up to the bigger is better, but not always.
I noticed it recently on the Grammys. Actually, the trend was to looking a little more normal, which was shockingly nice.
Yes.
And I saw, Miley Cyrus, and we can talk about her later, or even Taylor Swift. I mean, everything looked a little bit more normal versus, the big lips, the big breasts, and and the boobs and everything. And again, these are just we're just giving you our opinion as plastic surgeons. Whether people want to do that, that's their own style. But I think that it should, elegance in plastic surgery means that you can't see it or think, wow, that looks great, versus, wow, she definitely had a lip job or a boob job. And I think, most normal patients don't want that. When you say, I actually spend a lot of time taking fillers out of the lips and other places because they come back from their vacation place and then they want to look more normal when they get back to Dallas. And, it's a vicious cycle. And the other thing is, a lot of these, fillers aren't necessarily totally resorbable.
Yeah. I mean, I think we're finding that fillers are sort of lingering around a lot longer than what we expect, right? The usual 6 months to 18 months, plus or minus a few months. So, but yeah, I think a lot of my patients, especially the new ones who've never had Botox or fillers, are nervous when they come in because, they feel like they want maybe a little bit more plumping or volume of their lips or cheeks or whatever the area is, but they're scared that they're going to have these unnatural kind of over-exaggerated results. But I always tell them, listen, if 99% of the time, you're walking by people who've had these procedures done and you'll never notice because the results are, like you said, so elegant and natural that it just looks like they were born that way, right? And that's really the goal, at least when I see my patients, when I talk to them about, their...
And they will come and I think it's a good thing because they'll look at your social media, look at your Instagram, and if those patients look normal and then you and your staff look normal, that's a plus.
Yeah. Absolutely.
Tell me, they say, hey, all your staff looks great, but not like they've had anything done, and some have some. But that's what you want. That's a real compliment versus they come in and they go, I don't like that.
Yeah. No, I always joke. I mean, if you walk into an office and that's not your aesthetic, the people there don't look, like how you want to look, then you should probably just turn around and walk away because, you want to find an injector, a plastic surgeon, someone who has the same aesthetic as you are. And I think, that you could feel confident that you'll get the results that you want.
Right. And I think patients usually are drawn to that. today, especially with social media, they'll say, "Hey, I liked seeing your results on Instagram. I like that," and versus, some of the outrageous stuff you see, and I think that's a good thing. So let's talk more about that. I mean, I noticed the trend certainly has been to smaller buttocks. I mean, and not only has it become smaller, but I think it's been safer. I mean, we certainly start from the Kardashians on down. It looks like things are getting a lot smaller. And I think that's a good thing. Not only is it smaller, but it's safer too, because we now really have a safe way of doing, that's, buttock fat augmentation, because we use ultrasound. So are you seeing that trend as well in the Northeast?
Yes, absolutely. And I think, in general, at least, in the Northeast with my patient population, it's definitely smaller breast implants, smaller volume, or like the trendy term, I guess now is skinny BBL is what all my patients call it from TikTok. But it's really more of just kind of optimizing the proportions, right? So you're doing liposuction around the waistline and then adding the fat in the buttock to really just improve the contour and just the overall shape. So it's a very elegant, feminine procedure, which is definitely more common in my practice.
Yeah, and I think that's what you want. I mean, I don't ever do anything that I don't think will look good on them. If somebody wants to come in, they want a 900cc implant, and they're, 5'4", and I can't do that.
Right. And you want them to also have great results for a long time, right? And in some of these really overly done procedures don't last, they don't last. They don't pass the test of time. So, so we want to sort of minimize some of those long-term issues as well.
Right. And anytime you see an influencer that's trying to do it all or trying to look like some famous celebrity, I mean, it usually doesn't have a good ending. Long-term and short-term, and it's not a good thing to do that. The Kens and the Barbies of the world that have had 10, 20 operations, and I just, I think it's just out there.
It's insane. And I think, people forget that just because it's cosmetic surgery doesn't take away from the fact that it's still surgery, right? This is still medicine, that we're still there can be complications, there can be issues, there can be consequences. It's not it's not going to the salon and getting your hair blonde one day and then red the other day. There's a lot more at stake. And so I think to do your due diligence before making these big decisions to operate on your body.
Right, I agree. I mean, you can take the shoes back, you can't take your nose or face back or breast back. I mean, that's I mean, I know Amazon makes it easy, but you can't put your nose back in there. So
you can't reverse it like everyone likes to, get a BBL and then I'll reverse it later. It's not that easy.
Right. So tell us also about, since the Barbie movie, about the Barbie talks, for the traps. I mean, first of all, I've been doing that for years for patients with migraines and have, upper lateral neck pain and stuff. But so tell me about that. Are you doing the trap box?
Yeah, I think that with everything else is trending, right? And so it's sort of dying down now that the Barbie craze is dying down. But I think in certain patients, it's a great treatment, especially if you do carry a lot of tension in that area. And so I think the good thing about having these sort of trends is that it brings awareness to patients that are having issues, that there is an option. They don't have to sort of suffer through it. So I've seen some good results with it, and like you, I've been doing it in my practice for a while. So
yeah, no, I agree. It's just like the use of Botox for the masseters, and the big cheek patient, male and female, and also I think it's great because it can give you both a better shape and contour, but also it helps to improve bruxism, which is grinding your teeth, and TMJ and all those things, which is great because, if you don't have to have surgery, I mean, don't you agree? I mean, it's great.
A win-win. It's great, right? I mean, that's the benefit of having, Botox and even fillers and things like that. I mean, these days, even compared to when I trained 10 years ago with you, Dr. Rohrich, there's so much more we can do with these products and, different areas we can treat to not only help your appearance if you choose that, but definitely help symptoms that you might be having. So it's sort of it's a benefit all around.
Yeah, no, I agree. And even like the last year or two, people were doing a lot of buccal fat removal, and I think that's come down a little bit because I see patients, probably 1 or 2 a month, that have had buccal fat that should have never had buccal fat removed, and it actually makes people look older. You know?
Right. And that's the thing. We want fat in our face, right? I mean,
the one place we want fat.
Yeah, exactly. Like all those twin studies, right? Where you age better, we lose fat normally as we age. So why start that process early by taking it out when you're younger?
Yeah. So tell us, for the viewer, tell us how you can avoid all of these traps, these Instagram and TikTok traps. So what should they know, and who should they see so they're kind of safe? Because it's really the injector, the surgeon, that really is the gateway, don't you think?
Absolutely. I mean, exactly. I think picking the right surgeon, the right injector is going to be the most important thing. I always like to say, right, it's the right surgeon, the right patient, and the right procedure. And basically what I mean by that is you want to pick someone who's board certified, plastic surgeon. You know that their training is appropriate. They understand the anatomy. They're safe, or injectors that have been trained by them, or dermatologists. But, a right patient, you want to also make sure that you're healthy and, or any medical problems that you have are managed well so that you don't have complications from procedures that you might undergo. And then, of course, the right procedure, right? You want to make sure that you're going to someone who's going to recommend the right procedure for you that's also safe.
Right. I agree. And many times, like I saw a patient today that she wanted so much done to her face, and I basically usually inject half of what they want. And certainly I have some guidelines, and I just say, we're going to do this to your face. I don't inject by the syringe, I inject by the result. And what I see is that, like in the lips, I don't inject more than a cc anytime in the lips because I want to see how they look versus kind of like, it's like going to the gas station and overfilling your gas tank. You can't do that. It'll run over. And these are the same way with the lips. So I just say, hey, I'll see you in 6-8 weeks. And it's infrequent that, you need, if you inject fillers properly, so much it's not the volume, it's where you place them. And that's so important. And I just kind of have to calm them down. And many times they'll come back and they'll say, wow, I can't believe that we did it with so few things that you recommended versus, the plumped up thing.
Yeah. Well, I mean, I agree with you. I think less is more, right? I mean, the whole point of all of this is to look your best at your age. And I think the problem we get into is when, patients are getting over injected and they start getting that pillow face. And then at some point, people, that normal is reset and people think that that's the normal. And so, taking a step back and just sort of starting small. You always have the flexibility to add more, like you said, in however many weeks. And so less is always more, in my opinion, for anything that we do.
Right. And the option is not, we can melt it out, because that's not, to me, a good option. The option is to find someone that actually will not have you do that later, and especially with a filler. So it's great. Well, wise words from an incredible plastic surgeon, Dr. Smita in New Jersey. And if you're in the Northeast, she's the plastic surgeon to see. So Smita, tell us your Instagram and TikTok. It's at Smita, and you're in New Jersey.
Yes, I'm in New Jersey, in Montclair and East Brunswick, and I'm at the Dr. Smita on Instagram and TikTok. So it's been really fun. Thank you so much for having me today.
It's my pleasure, Smita. It's great. You look great, and we'll look forward to seeing you soon. All right, thank you so much. Helping you become a better you.